My name's Daniel Murphy. I'm a GP based in Honiton in Devon, and I also work as a hospital rheumatologist in Exeter. In patients diagnosed with axial spondyloarthritis, there can be some confusion as to what is a GP's role, what is a rheumatologist's role, and what's the role of the specialist nurse in hospital. As a GP, my role in the care of somebody with axial spondyloarthritis is really key. GPs are at the centre of a wheel. We connect all the spokes that come in to manage a patient's condition. GPs are key at diagnosis. They may well be the first people to recognise symptoms of an axial spondyloarthritis and refer somebody onto hospital. When you go to see a GP, sometimes it can be really difficult to remember all of the symptoms that are important. You may have had symptoms for months or years. Writing these down can be really helpful, or you may want to take a friend or family member along with you. It can be really helpful for your GP if you take a written list. In particular, your GP will want to know when the pain started. Where is the pain? Does it just affect your back, or your buttocks, or your legs? When is the pain worse? What have you done to help? Are there any treatments that have really settled it down for you? Family history can be really important too. So asking family members if they've ever suffered with back pain or some of the conditions that we know that can be associated with spondyloarthritis, such as psoriasis, inflammatory bowel disease such as Crohn's or ulcerative colitis, disease affecting their eyes such as iritis or uveitis. To GPs, the key part of making a diagnosis of axial spondyloarthritis is the patient's story. The way a patient describes their symptoms is really important in helping us decide what may be causing their pain. If your GP is concerned that you may be suffering from axial spondyloarthritis, they may well wish to refer you on, either to a physiotherapist, a GP with a specialist interest, or a hospital rheumatologist who can assess your symptoms in more detail. Sometimes your GP may request further blood tests, or occasionally scans or x-rays, though this depends on local practice. Once a diagnosis has been made, they will often prescribe anti-inflammatory drugs to help with your pain. They can help think about the other parts of your body that can be affected by disease. We know that patients with axial spondyloarthritis are more likely to suffer problems with their mental health, such as depression and anxiety, and GPs can be key in recognising and managing this. Patients with axial spondyloarthritis can have problems with their eyes, their skin or their bowels, and GPs are very good at recognising these problems. GPs play a key role in coordinating your care, talking to lots of different specialists who may be involved. GPs can coordinate between your rheumatologist, between your physiotherapist, between your occupational therapist, or other hospital specialists who may have been involved in your care. Axial spondyloarthritis can affect many different parts of your life. Patients with axial spondyloarthritis can sometimes struggle with work. It can affect your family life. It can affect your social life. GPs play a key role in helping minimise these effects. Medication can be really effective at controlling the symptoms of axial spondyloarthritis, but there are some really important lifestyle changes that people living with axial spondyloarthritis can make. Stretching is incredibly important. This is the best tool for reducing pain, stiffness, and making sure that your back and pelvis stay nice and supple. Stopping smoking is really important. We know that smokers have more symptoms, are more likely to be disabled by their disease, and treatments are less likely to work if you're a smoker. Your GP can definitely help you give up smoking if this is important for you. Weight loss is important too. We know the more weight that you carry, the more stress this puts on your back and pelvis, and can cause increased levels of pain. Overall, there are loads of changes you can make to your lifestyle to help you control your disease. Your GP can definitely help you with this. In general, axial spondyloarthritis doesn't increase your risk of picking up infection. However, there are some types of medication, called biologic medication, that your rheumatologist may wish to start for you. In this case, it's important that you have certain immunisations or vaccinations before you commence the treatment. Your GP can provide the annual flu vaccine and can provide the pneumonia vaccine. It's also important if you take biologic medication and you have vaccines for travel, that you tell your GP that you're taking biologic drugs, as this can change some of the vaccines we may wish to give you. If you're concerned that you may be developing axial spondyloarthritis, your GP should be your first port of call.